And welcome to the Dr. Bob Show. When the spring of the year comes around, it's so beautiful. The grass turns green, the flowers are blooming and smell so fragrant, the birds are chirping. But at the same time we hear the chirping of the birds, sometimes we hear other noises, sneezing and sniffles and coughing and wheezing, sounds of spring allergies. We'll be spending most of this show talking about spring allergies and what we can do for them. My guest is Dr. Erin Rohman. Dr. Rohman is a board-certified allergist. She'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about thyroid disease and some of its symptoms, much more common in women, and that old nagging cough. Is there a way that we can get rid of it? Could it be due to blood pressure medicine or something else? You'll want to stay tuned. A lot of information for you. We're talking with Dr. Erin Rohman, board-certified allergist, and we're going to be talking about spring allergies. Erin, welcome to the Dr. Bob Show.
Thanks for having me.
In the spring of the year, what are the main problems that we see?
Well, patients complain of a lot of things, starting with itchy, watery eyes, runny nose that's usually clear, sneezing, itching of the nose, ears, drainage down the back of the throat, postnasal drainage, that can lead to a cough. And then some other things that they complain of that they don't always know are related to allergies are things like headache, fatigue, not feeling well, not feeling like working or playing.
So all that goes along with spring allergies. Sometimes we call that hay fever. Why do we call it hay fever?
Well, hay fever really is just another word for allergic rhinitis. And a lot of times people feel feverish, and hay can be an allergen, and so pollens are sort of related to hay in that sense.
So tell me about what are some of the things that cause spring allergies?
Spring allergies are typically due to pollens in the air, and around here we have plenty. Tree pollen primarily, and then in late spring we start to develop the grass pollen.
So tree pollen will start about when?
Well, it's already started, so it's mid-March, so early March sometimes we get tree pollen.
And are there certain trees that cause problems, or almost all trees?
Really, almost all trees cause problems. There are certain ones locally that cause more problems than others.
So if I'm allergic to tree pollen, do I have to walk under that tree as it's pollinating to get the problem? How does the pollen find its way to the sufferer?
Yes, unfortunately you don't have to be right next to the tree. Tree pollen can float for miles through the air, so a particular tree could be far from you and you would still be exposed to the pollen in your nasal passages.
So if we've got a certain tree, a birch tree or an oak tree or elm, do they put out pollen for 3 months or usually 2 months, 6 or 8 weeks?
Yeah, I think that the time frame would be more like 6 to 8 weeks for most of the tree pollens. Unfortunately, by the time you get to the end of tree pollen season, grass is already in full swing.
So the tree pollen would be March, April, into May?
And starting into May as well.
And grass would be?
Well, I think we pick up grass at the end of April and early May sometimes.
So there's even a crossover of both of them.
Absolutely, there's an overlap.
Is that the yellow stuff that we see on our car that we can write our name?
All over the car, that as soon as you wash it off, it's right back the next day.
So that's pollen.
That's right.
Well, we don't see it when it floats around the air, but we see when it settles.
That's right.
We can write our name there. So how does it cause symptoms?
Well, that's an interesting question. The pollen first gets into our nasal passages and exposed to our cells when we inhale it. So when you breathe the pollens in, that pollen rests in your nose. You have cells in your nose that recognize that pollen as foreign. They will then help create an antibody called IgE, and I like to call that the allergy antibody. Then when you're re-exposed later, that same pollen gets in your nose and that IgE really flares up. It binds to the allergen and then binds to cells that create molecules like histamine. That histamine is then responsible for all of those symptoms you're feeling: sneezing, runny nose, coughing.
So let's go through the nose symptoms. You said sneezing. Is there a certain picture that you think of when you see somebody rubbing their nose? Why are they rubbing their nose?
Well, usually they're rubbing their nose because it's itching. And then, of course, you get that drainage out of the front of the nose, and so that's embarrassing, so you're trying to swipe that away.
When you sneeze, is it just once or twice, and sneeze 4 or 5 times
Oh,
a day?
some people can sneeze all day long, it seems, several times in a row.
It's very, very difficult on somebody when they're sneezing. You mentioned fatigue.
Sure.
Why do people get fatigue if they've got runny, itchy nose?
Well, when you think about that, you're not sleeping well typically. So at night, that runny, itchy nose can turn into drainage down the back of the throat because you're lying flat. That can lead to a cough. And if you're not sleeping well, you're not performing very well the next day.
How about the eyes?
Itchy, watery, red.
The same allergic reaction occurs in the eyes that occurs in the nose?
Typical, yes, same thing.
You get itching of the roof of the mouth?
Absolutely, and in the back of the throat even.
So it just makes the person absolutely miserable. What about school performance
Yes.
or work performance or work days lost? What happens?
Right, so if you have a child that's not sleeping well at night, you have a parent that's not sleeping well at night, and then neither are performing well the next day. A child who doesn't get the proper sleep can't concentrate in school and focus on what the teacher's telling them. Same thing in the workplace. If you're not sleeping at night, you're probably snoozing in the daytime at work.
Is there a way that we can avoid the pollen in the spring when tree season's there, March, April? What can we do?
Well, there are a few things that we can do, but not many. You could keep your windows closed in your home in peak pollen season and not let the cool breeze blow in. You could keep your windows rolled up in the car as well.
So those cut down a little bit of exposure, but if you're outside, it's going to get you.
That's exactly right.
So,
and we love being outside.
Yeah, and it is fun. Certain times of day that somebody should be outside more or less?
Well, you know, morning hours are particularly bad for allergies.
And how about windy days versus non-windy days? How about rainy days and non-rainy days?
Well, it's hard to be outside on rainy days in general, but you would have less tree pollen in the air on rainy days.
The day after it rains or just when the rain's over, does that wash the pollen out of the air sometimes?
Well, you'd like to hope so, but sometimes that can just bring about the pollens the next day.
So the symptoms that somebody has, if they've got a stuffy nose and they've got congestion, do they complain more of itchy, sneezy, or my nose is just blocked up and I can't breathe?
Right. Well, patients can certainly experience all of those, but I have found in my patients that the congestion is more bothersome. It's more difficult to treat and tends to be a little more bothersome for the patient.
So if the nose swells, gets all congested, can it cause other problems in the ears or the sinuses?
Absolutely. It can cause improper drainage of the sinuses and the ears. That can lead to sinus infections and ear infections.
So it's a real big mess that we have.
Absolutely. One thing leads to another, you know.
When we think of spring allergies, we've talked about tree pollen and grass pollen, and we've talked about the nose, we've talked about the eyes. Do the lungs, are they involved in allergies too?
Absolutely. There's a hypothesis called the one airway hypothesis.
One airway, that would mean starting where and ending?
Starting in the nose and mouth and ending down in the lungs.
And so you can have the same allergic reaction in the lungs. What symptoms?
That's right. The same mediators that bother the upper airway bother the lower airway as well. Coughing, wheezing, tightness in the chest, shortness of breath, those can all be signs of allergies of the lungs.
So now we're getting into big time problems. How does mom recognize that's going on in her children?
Well, you just have to watch and see how they're doing during playtime maybe. If they have trouble keeping up with some of the other kids, if they seem to be coughing or short of breath, that might be signs of asthma.
If they've got spring allergies, does it occur every spring, or you get 2 springs and then you get one off, or what happens?
Well, I have found in most of my patients that it gets worse spring after spring after spring.
So it seems to be that the allergy cells in the nose get primed, and
right.
as the season goes on, it can get worse, and every year it gets worse.
And every year, that's right.
So is there good treatment available for somebody that's got nose allergies?
Absolutely.
Allergies?
There are great treatments available.
And that's what we're going to be talking about when we come back. We're going to be talking about what treatment is available if you've got sneezing and itchy nose and runny nose and itchy eyes and teary eyes, and you can't sleep and you don't feel good and you've got, sounds pretty miserable, coughing and wheezing. What can we do for it? You'll want to stay tuned. We're talking with Dr. Erin Rohman, board certified allergist. We've been talking about spring allergies, runny, sneezy, itchy, watery nose. We've itching and tearing of the eyes, coughing and wheezing, miserable, missing school, missing work, not feeling good. It's a pretty terrible illness when you talk about it. How's the diagnosis of spring allergies made?
Well, the diagnosis starts with a simple history and physical exam in the office, and that can often lead to skin testing, which should be done by a board-certified allergist.
And the skin testing, what goes on with skin testing? Is that behind the doors?
So skin testing actually is really simple. You're going to disrobe from the waist up. You're going to have some plastic devices used to just barely scratch the surface of your skin.
And when you scratch, what are you looking for when you scratch? Do you have to put a drop of something on it or what?
Yes, that's right. We put a drop of antigen on the tip of the device, scratch that through the skin, and then look for your body's response to that.
And the body's response, if you're allergic and you scratch the skin, and we were doing oak tree because they were having problems in March, April,
yes.
What would it look like?
Just a small swelling surrounded by what's called a flare, which is some redness that we can actually measure in the office.
So it looks like a mosquito bite?
That's right.
Does it itch?
It certainly itches if you're allergic.
And how long does the itching last?
You know, itching lasts usually just minutes to an hour maybe.
So it's not really anything that's going to last for a long period of time?
Oh, no.
Now, do you do several trees, or are you just looking for 1 or 2 trees in this area?
We do nearly 20 trees on adults.
Because there's a lot of trees that
That's
cause
right.
problems.
There's a lot of pollen trees out there.
So are people allergic, if they're allergic to trees, do they show up to all 20, or they may show up to 5, or everybody's different?
That's right. Everybody's different.
And when you show to tree pollen, that tells the doctor which tree is causing the problem. Then you go to grasses also?
That's right. We have grasses and ragweed as well, as far as the seasonal allergens.
And what time of the year is ragweed usually?
Ragweed starts in very late summer, but really picks up in the fall.
Okay, so we've got spring allergies, we've got trees and grasses. We put on the little prick test of that. They show up to a little redness and a little itching place, and then we know that they're allergic to those things. Let's talk about treatment. How do you treat spring allergies?
Well, there are 3 ways to treat allergies. The first thing to do is avoid it, but does that seem practical to you? No, we all enjoy being outside, so avoidance typically is not really effective.
So then we use medicines you can get over the counter?
There are a few available medicines over the counter. The difficult part for that for patients is they don't know what to pick up. Do they need a pill? Do they need a nose spray? It's confusing.
So what are some of the things that you prescribe for people that are having allergic hay fever or allergic rhinitis in the spring of the year?
Typically, I start with an antihistamine, which is a tablet that you take by mouth, and then we move on to nose sprays, and those can be nasal steroids or nasal antihistamines, even a combination that's out now.
So you've got pills and sprays. Let's talk about the pills. Let's talk about the antihistamines. What do they do for the allergic reaction?
Typically, they just dry up the itching and the runny nose.
So the congestion, the blocked head, the I can't breathe, all those stuff, it doesn't help as much.
That's not going to help.
So
no.
what do you have to use for that?
Then we move on to the nasal steroids and the nasal antihistamines, the nose sprays.
So there are antihistamine nose sprays?
That's right.
And so they'll put the antihistamine on the nose?
Right on the nose.
Right where you want it?
That's right, and very effective.
Tell me about the nasal steroids.
Now those also are deposited right on the nose where they're needed. The difference is they have to be used several days in a row before seeing a real benefit, and that can be frustrating for patients.
Sure. Now, are some of those medicines over the counter, the antihistamines?
Yes.
And the steroid nasal sprays?
There are a couple out now, yes.
So if we've got Nasacort and Flonase that are over the counter, and you use those, how does the patient know how to use them?
Well, if the patient hasn't been into a physician's office, they may not know how to use them.
So you mentioned the steroid nasal spray may take 2 or 3 days to work, or 3 or 4 days.
That's right, or up to 2 weeks for some patients.
Are there some problems with the steroid nasal sprays? Do you get nosebleeds with them?
You can get nosebleeds. Some patients have headaches, and I've seen even more severe complications in patients who were not followed by their doctor while using a nasal steroid.
So what about the antihistamines? Are they dangerous?
They are fairly safe. They have a good safety profile. The problem is the side effects that are just bothersome to patients. They can make you feel more tired than the allergies sometimes.
So if you have the patient in the office and they tell you that they've tried an antihistamine over the counter, what is going to be the first thing that you're going to prescribe for them in your office if their nose is all swollen and it looks allergic and their eyes are red? Let's talk about eye drops and let's talk about nose medicines.
Sure. So there are eye drops that are available both over the counter and by prescription, and they are called ocular antihistamines. They're typically used once or twice a day, and they provide fair relief of the eye symptoms.
Do they sting or itch, or do they take away the itching?
You know, when a lot of patients complain that when they first feel the drop go in, there is a momentary itching or stinging.
Okay, and so those work pretty good.
They do.
Any names, Zaditor, Opcon A?
Yes, those are some of the ones that are available over the counter, and by prescription, Patanol or Pataday.
Okay, and the steroid nasal spray that you would prescribe in your office would be?
Something like Nasonex or Omneris. Those are a couple of the more popular ones.
And you mentioned there's a combination because
Yes.
this has really been an innovative thing. Tell me about the combination.
The combination is called Dimista. It combines both a nasal steroid and a nasal antihistamine. So rather than using 2 sprays twice a day, you can use 1 spray.
And does it work just as good?
Absolutely, it works just as well.
And that's called Dimista. So we've
Yes.
got a Dimista spray. Let's get into the only way to get rid of allergies. Is there a way that, I'm sick and tired of allergies every spring. They're driving me crazy. I can't perform. What can I do? I've tried medicines. What else is there?
Your best chance for a cure is immunotherapy.
Now, what is immunotherapy?
Immunotherapy typically is allergy shots done under the guidance of a physician.
Okay, so these are allergy shots. What are in the shots?
The shots actually contain the allergens to which you're already allergic. There are no medicines, no steroids. Parents are concerned about what is in these shots, but actually it's very natural.
So when you did the skin testing, you found out which allergens. Are those the allergens you picked to put in the...
That's exactly right.
So you use those for the immunotherapy. Do you have to start at a real strong dose to see how they're going to do, or at a weak dose?
Actually, we start at a very low dose so that it's very safe for the patient, and we build up those doses over time so that your body develops a tolerance through the immune system to the things that you're allergic.
So how often do you have to come and get these shots?
Once or twice a week in the beginning, in the end, once a month.
So when you're getting your shots, they inject into the hip or the leg or the arm?
The upper arm, actually.
In the upper arm. And so when they inject into the arm, the immune system does what?
Well, the immune system immediately recognizes the antigen and slowly over time will build a tolerance for the patient.
And when the tolerance means what?
The tolerance means that your body is no longer bothered when it encounters those antigens. So when you inhale those spring pollens, your body doesn't respond by going haywire and making all those terrible symptoms for you.
Does it usually take 1 year or 2 years or 3 years for that to happen?
Oh, actually, we start seeing results with immunotherapy in as little as 4 months.
So when you're injecting into the arm what they're allergic to, you build up tolerance to it, where when you breathe in the oak pollen or the pollen that's out in the air, it doesn't bother you. It doesn't cause the runny nose, sneezing. Don't have to take medicines.
That's right. Most patients see that they need no medicines eventually, but definitely a reduction in the medicines that you would need.
When somebody has multiple trees and grasses, can you combine them all, or do you have to give a shot for each tree?
Oh no, we combine several. Some patients need 1 shot, some patients may need 2 or 3 when they go in.
And when you start off twice a week or once a week?
Typically we start off twice a week, but even if you can get there once a week, that's a good shot.
And when you reach your big dose, the maintenance dose,
Yes.
Do you take them once a week for?
Typically 9 months to a year. You and your doctor will decide on that.
And then you go to
Every other week, then every 3 weeks, and like I said, eventually once a month.
And so is there any other way to get rid of the allergies?
That's the only way that we have found to really rid ourselves of the allergies.
So if somebody has hay fever in the spring and they don't respond to medications, then they should see a board certified allergist
Yes,
and get started on immunotherapy, the only way to get rid of it.
that's right.
Erin Rohman, you're amazing. You're a great
you.
teacher. Thank you for
Thanks.
coming to the Dr.
Thank
Bob
you
Show.
for having me. It was a pleasure.
Yeah, it was my pleasure to learn from you.
Thank you.
And thank you for coming. Great information for you and for me. You're going to want to stay tuned. We're going to be talking about thyroid disease, more common in women, but men get it too. Where is the thyroid gland? What does it do? And the old nagging cough. Could it be due to blood pressure medicine or even allergies? You'll want to stay tuned. A lot of information for you. I want to thank Dr. Erin Rohman for her wonderful discussion on spring allergies. She's a superstar as an allergist. And now for questions from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob. My doctor says my thyroid gland is swollen. Is that dangerous? Well, that's a good question. Everybody has a thyroid. A thyroid is in the lower part of the neck. It's a butterfly-shaped gland, so there's a lobe on one side and a lobe on the other. It puts out a hormone called T3 and T4. Those hormones are responsible for how we feel, for how our cells work, to how energetic we are, to how much moisture is in our skin. That's all because of our thyroid hormone. Now, if the thyroid gland is swollen, it could be for 2 reasons. Number 1, it could be an overactive gland. And an overactive thyroid gland makes people feel nervous and excited and irritable and speaking real fast and always doing something. And they lose weight even though they're eating, and they're just getting faster and faster and faster and faster. That's a sign of an overactive thyroid. An underactive thyroid, not enough of that T3 and T4 hormone, then you feel tired and sometimes depressed and sometimes sluggish, and your skin gets dry and your GI tract doesn't work as well. Women's menstrual cycles become irregular, and so all of that can be due to changes in your thyroid gland. If you've got swelling in your neck, then your doctor will measure thyroid studies. The best one is called a TSH. It measures how much the pituitary gland is trying to control the thyroid. Your doctor will know if it's underactive or overactive. So let's say that it's normal, but the lump the doctor felt was a little nodule, and you can get a little nodule in the thyroid that can put out too much hormone, or it could put out not enough hormone, or it could even be cancerous. So if you've got a thyroid nodule, usually they'll get a needle biopsy, a little thin needle that they'll put into the nodule. Look under a microscope, they'll find out what it is. Usually it will be benign, but you'll want to know. So a thyroid examination is part of the blood work you get, part of the physical exam, and if it's abnormal, know that there's excellent treatment. If they have to get rid of your thyroid gland, the cheapest and best medicine we have is thyroid replacement. So pay attention to your thyroid. Feeling too overactive or too underactive, talk to your doctor about your thyroid gland. Dr. Bob, I'm a 55-year-old. I have hypertension and a nagging cough. Could my nagging cough be due to blood pressure medication? That's an excellent question. Now, a nagging cough is a cough that's been there for at least 4 to 6 weeks. There are several different kinds of cough. Number 1, a rattling old cough that the smoker has is usually an infected chronic bronchitis cough, whereas the cough that's a nagging cough is usually a dry, non-productive cough, an irritative cough. There are 2 blood pressure medicines that can cause cough. Number 1 would be what we call an ACE inhibitor. The most common cause of a dry, relentless cough is an ACE inhibitor. The medicine works on part of the gland above the kidneys to lower your blood pressure, and it can cause chronic cough. What you have to do is you have to stop it, and you have to stop that medicine for at least 4 weeks and probably 6 weeks. Another blood pressure medicine can cause cough. There are some people that cough because they've got hidden asthma. We call it cough variant of asthma. They're not wheezing, they are short of breath, but a beta blocker can make the normal airway more narrowed. And if it gets more narrowed, The only way the brain has of opening up the lungs is that nagging cough that you might have. So if you've got a nagging cough, we think of, is it drainage? Is it reflux? Is it blood pressure medication, a beta blocker or an ACE inhibitor, or a cough variant of asthma, or after viral infection? All of those can cause cough. Well, that's all the time that we have for this show. Remember those 4 things that we like to do on the Dr. Bob Show, and they're so important. The most important thing that you and I can do to get rid of stress, to maintain our weight, is exercise. You don't have to really be a world-class athlete. You just grab your tennis shoes and you walk out the door. And when you walk out the door, you're either going on straight level or down a hill or up a hill. And start walking just a short period of time and increase that to where you're walking 45 minutes to an hour every single day. Make it a fun time. Grab somebody in the house that goes out and walks with you. We have to get 7.5 hours to 8 hours of sleep every night. There are so many reasons why we don't get enough good sleep. It may be pain, it may be medications, it may be that we don't prepare the room for sleep. So we're using our cell phones or we're watching television. Sleep in the bedroom is for sleep, and so get your 7.5 hours of sleep. Eat properly. We all know how to eat properly, eat less, and most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Find somebody you want to giggle with, have a good time, and you'll stay healthy laughing.